We want to avoid heat lamps, antacids, and other topicals that will dry the wound. We want to keep it moist. However, on the other spectrum, if a wound is excessively wet, if it has large amount of exudate, a large amount of drainage, we want to work to decrease the amount of wetness. We want that balance, right? We want to remove those extra exudates because we know that it can support bacterial growth, but we still want it moist, but not, it shouldn't be saturated. Now, I want you to stand up and stretch because some of you have sleepy eyes. Stand up, stand up, stand up. Take a stretch. Check on your neighbor, make sure they're awake. All right, and I also want you to tell your neighbor 3 things that you learned in class today. Our primary reason is to protect the wound from outside organisms, microorganisms. We want to aid in blood control or hemostasis, right? We want to stop the blood flow. We want to promote healing by absorbing that extra drainage and debriding the wound. We want to support and split the wound, right? It feels better when you get a Band-Aid on your cut, right? It just feels better. Same thing with our surgical wounds. And we want to promote thermal and mechanical insulation to the wound surface. Depending on how deep that incision is, we may need to promote thermal and mechanical insulation. And we want to promote or provide maintenance of high humidity between wound and dressing. So we want to keep that moist environment, but not so wet that it actually allows bacterial growth, right? So dressings are identified by layers. There's different layers. The contact layer actually comes in contact with the wound bed. And then there may be an absorbent layer to help with extra exudate. And then an outer protective layer. And our outer protective layer, they may be occlusive or semi-occlusive or non-occlusive. So occlusive is used for sealing particular types of wounds and their surrounding tissues off from air, fluids, and bacteria. So nothing comes through. It stops any flow in or out. These dressings are often used for immediate damage, tissue damage. We want to control the cleanliness of the wound. We want to control the blood loss of the wound. So this might be something that we initially use with our dressings as an outer protective. Nothing comes in or nothing goes out. They're air and water tight. Semi-occlusive is our dressing outer protective layers that are moisture or vapor permeable. So water and gas can pass through them to some degree. All right, semi-occlusive. Non-occlusive outer protective dressings, they don't seal out air or water, right? So they're not a barrier against the flow of air or water or gas, okay? With that in mind, a common dressing that we see is gauze, and it comes in a variety of sizes, and it is considered a non-occlusive dressing, so it allows the flow of air, and it can be used as an absorbent dressing, so it will absorb exudate. And it's commonly used in our dry, sterile dressing changes or our wet to dry dressing changes. You'll see gauze ordered. Another type of wound dressing that we will see and we use quite often is a non-adherent gauze, Telfa. Again, it's still non-occlusive, it's absorbent, but with Telfa, it does not adhere to the wound. When you get a Band-Aid, that little shiny piece in the middle of the Band-Aid, that's Telfa. So it looks like that. It's a little bit shiny, and it comes in different sizes. If we are just trying to keep our wound protected and moist, and we're not trying to debride, then Telfa might be a good option. Another type of outer covering, which is semi-occlusive, is the self-adhesive transparent film, or the Tegaderm. Tegaderm is probably one of the most unforgiving pieces of dressings component that you'll ever use. It does keep bacteria out, but it allows oxygen in. It promotes that moist environment, and more importantly, it allows the nurse to visualize that wound right then and there. So Tegaderm. Hydrocolloid is a dressing that is an occlusive dressing. So does it allow oxygen to penetrate? No. No, it does not allow oxygen to penetrate. It supports debridement and infection prevention. Sometimes your superficial and your partial thickness wounds, they'll be ordered a hydrocolloid wound dressing. They might have light to moderate drainage. So with this dressing, if they have heavy exudate, this is not going to hold them. So this would be good for light to moderate drainage. Hydrogel. This dressing, it does help with debridement, but it also requires a secondary dressing. It's not highly absorbent, but it's good for wounds with minimal drainage. And it looks like that. So hydrogel dressing. Your alginates. These are very absorbent. So they're highly absorbent. They're made actually from seaweed. And they're available in a sheet form or a rope form. When it comes in contact with the wound bed and the exudate, as it absorbs it, it creates a gel-like substance that causes a gentle debridement. And it's used for moderate to heavy exudate. It also requires a secondary dressing. So this is the rope, or this is the rope version, and then there's the sheet version. So you actually just pack the wound with it, and then when it interacts with that exudate, it's going to turn into that little jelly type appearance, and it can emit an odor of its own. So that's what I was talking about earlier. And then also, when you have a patient that has alginate ordered for the dressing change, don't confuse that with suave when you go to remove it. All right, so it doesn't look quite as creamy yellow. It has a different appearance, but just if you see that in the orders, then you would expect to have some residual when you go to clean out that wound. So, collaboration. Our efforts are always focused on promoting the best outcome for our patient and to prevent infection from occurring and promote or keep their healing. They may order with wound care diagnostic tests. One of the biggest ones is going to be that culture and sensitivity, the CNS, so that we can identify the causative organism, and then the sensitivity part just speaks to what antibiotic, what medication will actually take care of that microorganism so we can treat the infection. Debridement, again, it may be a bedside debridement, wet to dry dressing change. We're doing mechanical debridement at the bedside. Or it may be a surgical debridement where they're using, this usually occurs if it's pretty deep in the wound or it's a large area. They may take them back to the OR and do the debridement, and they may even repair and try to close the wound back in the OR. So they would just use forceps, they would cleanse the area, use forceps, and cut away the dead tissue. And then also eschar-otomy, sometimes that's done when the wound has encircled a body part. Mostly on burn patients you'll see this. F-sharp, and that was that brown leathery appearance of tissue. When it restricts the blood flow, sometimes it can lead to compartment syndrome because the blood flow is compromised, so that you get that inflammation and swelling to the surrounding tissues. So if eschar is not treated, it can lead to compartmental syndrome. They may just take them back and cut that away. Pharmacology, therapy, depends on whether the wound is healing normally or is it impaired. If it's healing normally, they may just do like an antibacterial ointment to be applied. Or they may give prophylactic antibiotics after the culture sensitivity has been received. They may order pain medication. Some of these debridements are quite painful. So if they take them to the OR, of course, they will, determine, they'll probably do like a regional anesthetic there. At the bedside, oftentimes the patient will be giving IV hydromorphone or morphine to cover their pain. And then in some patients, they might use growth factors to stimulate the body's own ability to repair the wound. And those might be topical or administered via an injection. So that can be an option as well. Non-pharm therapies. There's tons of different non-pharm therapies, and the ones that we'll concentrate on is the diet. We want to make sure the patient is getting those proper nutrients that they need to support wound healing. And then as nurses, infection prevention measures. Not only are we going to do that, but we're going to make sure our patient understands whatever their discharge instructions are when they go home as far as wound care. So maybe they'll have a home health nurse that comes and monitors and does wound dressings, changes for them, or maybe their spouse is going to do it. So we would just need to make sure that they understand the importance of infection prevention methods. Hand hygiene is number one, right? And the use of clean supplies. In the hospital, if the dressing is ordered as a sterile dressing change, we're absolutely going to do it as a sterile dressing change. In the home care setting, oftentimes that same dressing change is not considered a sterile because the patient is in their own environment versus in the hospital, there's tons of pathogens or microorganisms that can invade that incision or that wound. And then sometimes compression bandages or TED hose are used to help facilitate wound healing, depending on where the wounds are. Sometimes the patients have leg ulcers, they'll have them wrapped. Have you seen that? And that's a non-pharm therapy. Continuing that would be our wound vac, vacuum-assisted closure device, hyperbaric oxygen therapy. There's some different regenerative therapies such as stem cells and skin or tissue grafts. Sometimes they'll have that. And biosurgery. So I'm going to show you a couple videos on the wound vac, and I'm going to show you a couple videos on the biosurgery. And then we'll take a break after that.
KCI's unique integrated vac therapy system promotes fast and effective healing across a wide range of wound types and provides benefits to patients in all care settings. When treating a wound using vac therapy, KCI's proprietary granny foam dressing, which is a reticulated open cell foam, is placed directly into the wound bed. A drape is used to cover the dressing. A hole is then cut into this drape before the painted-in track pad is placed over the drape to seal the wound and connect it to the therapy unit. In combination with sophisticated software, track technology helps provide uniform negative pressure to the wound surface. The application of negative pressure, when delivered through vac therapy, induces both a physical and biological response. Macrostrain is the physical response that can be seen immediately as the wound edges are drawn together. Other benefits include the reduction of wound volume, reduction of edema, the effective control of exudate, and the removal of infectious or inflammatory materials, including free radicals, which have been shown to impair wound healing. The effects of the biological response are initiated by microstrain. Microstrain results from the manifolding of pressure across the proprietary craniofoam dressing to the wound surface. This creates areas of cell surface strain or microdeformation. It is well published that cells respond to strain by expressing special receptors on their surface and turning on genetic pathways in the cell which promote healing activities. These include increased metabolic activity, stimulation of fibroblast migration, increased cellular proliferation, and extracellular matrix production. In addition, a decrease in edema and the subsequent promotion of perfusion at the wound site supplies the required blood, nutrients, oxygen, and growth factors required for healing. All this leads to the formation of granulation tissue in the wound bed, and the characteristic undulations seen in wounds treated with VAC therapy. Over subsequent dressing changes, the granulation tissue fills the wound bed fast, preparing it for final closure. This fast and effective integrated VAC therapy system positively impacts on the patient's quality of life and subsequently reduces overall therapy costs. KCI's unique integrated VAC.
Alright, this one, just bear with me. They're really happy.
Hi, I'm Nicole Tallow. Hi, I'm Sarah Jones, and this video will show you how to change wound bed dressing. VAC therapy is a new technology that increases wound healing in a unique way by drawing wound edges together, providing direct and complete wound bed contact, evenly distributing negative pressure, removing exudate and infectious materials, reducing edema, promoting perfusion, increasing cellular proliferation and migration, and promoting granulation tissue formation. The wound used for demonstration is a fasciotomy incision on Nicole's leg done for treatment of compartment syndrome. Wash hands. Apply non-sterile gloves. Close clamp and turn off pump to prevent reflux. Install normal saline through tubing and let stand 5 to 10 minutes to loosen dressing from wound. Remove old dressing. Cleanse wound bed with normal saline and remove debris if applicable. Assess wound bed and size. It should have pink and red granulation tissue. Note any drainage, tunneling, and cavities. Make sure wound edges are clean and dry. Protect peri-wound area with skin protectant. Cut foam to size and shape of wound. Do not cut over wound to prevent foam from falling into the wound.
This is a sterile
Shape foam
technique.
into wound. Fill wound with enough foam so that when vacuum supplied, the height of the foam is close to the top of wound margins. Cut and apply transparent drape material to cover the foam and wound. The drape material should extend out onto the peri-wound about ½ inch all around. When working with the KCI drape, follow the numbers for ease of application. Start with removing layer number 1.
She should have gloves on.
Cut 2 centimeter size hole in drape. Apply over the hole in the drape the SensaTrack pad with tubing arranged in comfortable position for the patient. Connect tubing from dressing to tube coming from back suction canister. The canisters lock together. Activate back suction unit and check for air leaks. Set therapy to physician's prescription. When suction is applied, the foam will contract to a raisin-like appearance. And remember to label the dressing with your date, time, and initials, and document your procedure according to your organization's policy. Thank you. Hi, I'm Nicole Tallow.
that's using negative pressure to remove excessive fluid from the wound or the exudate. It helps to improve oxygenation, and it helps blood flow to the area, and it promotes formation of granulation tissue. Right? So we've had great success with wound vacs. Wounds that would have taken, months and months to heal, the wound vac, with that in place, it cuts down that time considerably. So it's a good intervention. All right. So now I'm going to talk to you about biosurgery. So I'm going to show you 2 videos about biosurgery.
They are the stuff of nightmares. They dwell in filth and feed on decay. But maggots might also be the next thing your doctor pulls out of his medicine bag. Maggots are the larvae of another creature with an image problem, the fly. In nature, flies lay their eggs in rotting flesh, so the maggot hatchlings won't have to stray far to find food. This taste for dead flesh is what makes maggots taboo. But it also makes them perfect for use in medicine. Here in Wichita, Kansas, at the Wesley Medical Center's Midwest Center for Wound Healing, a new patient has come to try maggot therapy for the very first time. Cindy Kennedy suffers from diabetes. 4 months ago, she had an abscess taken from her abdomen that left a gaping wound. Conventional procedures are causing her so much pain that she can't cope. But if the wound is left untreated, infection might spread throughout her body and she could die. The solution? To place hundreds of live maggots into the wound. The secret lies in their eating habits. These maggots eat only dead flesh and leave healthy tissue alone. Dr. Terrence McDonald has been prescribing maggot therapy for 4 years.
The maggots are a kind of a cleaning device for these wounds. Not only do they remove the dead tissue, which removes the food source for the bacteria, then their saliva has antibacterial effects.
But to Cindy, the thought of maggots feasting on her body doesn't necessarily sound appetizing.
I'm like, God, that is gross, but they say it really gets the job done, so I'm willing to try anything.
The 2-millimeter long larvae are specially bred for use at wound care facilities. These maggots are newly hatched and they're famished. If they can clean up the green and black decaying flesh, they might save Cindy from having it surgically removed. Before the day is done, she'll have as many as 700 maggots placed in her wound. For 48 hours, the hungry maggots will feed on her diseased flesh. And when they finish feasting, they'll grow to 5 times their original size. 2 days later, Cindy returns to the clinic to see if the maggots have cleaned out the wound.
A lot of these areas are really a lot cleaner. The tissue that I can see in there is all pink. It's improved quite a lot.
But for Cindy, even a medical miracle is not enough to overcome her taboo for creepy, crawly creatures.
Yeah, it's scary, especially if you have a fear of bugs. They was only doing their job. I mean, I can understand that, and I appreciate that. But I'm glad it's over.
If maggots can overcome their taboo reputation, these creatures of death may keep eating their way to saving lives.
All right, one more for your viewing pleasure.
Linda Frank of North Syracuse started undergoing maggot therapy in the fall of 2006 to treat a heel wound and bone infection that was the result of diabetes. Prior to that, Frank was told by other doctors that the only option was amputation. So on her own, she researched maggot therapy on the internet, and then she asked Dr. Louis Bonavita of CNY Family Care in East Syracuse for help. She went to his office more than 20 times to have maggots applied.
Remember we put them on yesterday? How small they were.
We're scanning now, but either that or something.
Doing great, sweetheart.
The original infection started here and went all the way around your heel, and the maggots, as you remember, were placed here, and they consumed all the diseased tissue, and then her own natural body process closed this wound up where now we have normal, healthy skin here. It's no longer painful. This is a normal skin as you'll find on your body. The moral of the story is the maggot did their job. They removed the diseased tissue. Here's a woman who was about to have her leg amputated, as per the recommendation of 2 orthopedic surgeons, and because of the maggots, they debrided the diseased tissue. They removed all the bacteria. They removed all the devitalized tissue, and now this woman is walking into my office. Now, granted, she did a few other things which was important. She stopped smoking, which was key. She also got her diabetes under much better control. But clearly, I think if we didn't do the maggot therapy, she wouldn't have her leg presently. So, pretty impressive.
I wasn't want to let him get me down. I knew I had to do whatever. I had to do whatever I needed to do, and I guess it worked. Because here I am with a sneaker on. I'm able to get around. I mean, I'm driving. I do basically everything. You know, I've been out doing yard work now and raking. I cut the lawn. So I'm almost finished.
So biosurgery, the maggots digest the damaged tissue, and they leave the good skin. They leave it alone, so they don't bother that. So I'm going to let you go on break, but before that, I want to show you something. This is a maggot under electron. All right, I'll see you in 10 minutes.
Did it. It's so great. It comes with a pencil holder.
Did you buy this at Apple?
No, I got it. Yeah, no. Yeah, it's like shockproof, so if I drop it, it doesn't. Yeah, I'm very happy with it. And it has like a little thing so you can push it out, like the pencil. Once it's pushed in. You push it.
And then you direct?
Yeah. Yeah, it's great. My boyfriend, I told him how much the pencil was. And he's like, just $5 for the pencil? I'm like, beautiful. I'm very happy I got it.
Yeah, pretty much.
What is this? It's just smaller.
How much?
That one was $2.99.
Oh, that's cheap.
Yeah, the mini was $100 more. It's $3.99 for the mini, and it's not compatible with the pen. Like the pencil is $100, and then I got insurance on it for 2 years, and it's a free replacement if you break it. And altogether for the insurance, the iPad, the case, And the pencil was $500. It was like $4.99 and change.
That's not bad.
No, I saw the Pro. It's a little big, and I asked for the Mini, and I'm like, oh, that's more expensive than the regular one. And they said it only came in gold, but this is the new gold. Yeah, it's like, but it's not like, see, this is gold, like.
Yeah, I know, yeah.
Yeah, but it's not.
This is gold.
I say it's not the same as the rose gold though. Like my actual gold phone, it's a little more pink. Yeah, so I was like, I mean, I want rose gold. Close enough.
That's wonderful. That's
The last 2 months, and it's been like
Jose, did you find the information? Look that up real quick. Oh, is it cool? So And then I have a Cahoots game for you. Anybody grossed out by the magnet therapy? Anybody see beneficial use from the magnet? No? Yes, it is unconventional, but you know, if your patient is faced with the option of losing a limb or trying this treatment, I can see why they would want to try the treatment.
Is it widely used?
Is it what?
Widely accepted?
Is it widely accepted? It's not. I think in the medical community, yes, but it's not widely used in our area. So this is something that you might see, hopefully. I mean, that video, the one video I showed you was from 2007, and it's still not widely used. But that is an option. You know, if my loved one or myself was facing amputation, I would say, let's try that. You know, let's try the maggots before just jumping into the amputation. And you heard the one patient, she said that, or maybe the physician said, that she had 2 orthopedic surgeons. Their recommendation was amputation. And they were able to save her foot. So I think that's pretty impressive. All right, but it is kind of gross. You ready for lunch?